Hi, Dr. Nordstrom. Good to see you. Thank you for
Hello.
joining us tonight.
Uh,
Um, and thank you everyone for joining us tonight. So we are happy to present Dr. Nordstrom. He graduated from Robert Wood a while ago. He did his internship at Lenox Hill and completed residency at Hospital for Special Surgery in New York City. Um, as in the link I sent in the email, he's done a ton of firsts at Robert Wood, and you are yourself an athlete also, it sounds like, also an avid traveler.
yeah.
We are very happy to have you here. I do have the slides you sent, so I'm just going to share my screen. And you should all be able to see that.
Just great. Just click to the next picture.
Okay.
All right. Can you guys hear me?
Yes.
Okay. All right. What I thought I would do is leave a lot of time for question and answer. Okay, because you're going to have individual questions. I don't just want to. I'm not going to just tell my story, but I'll give you a short and sweet background, and then it might open up some conversation starters. Okay. So this is when my orthopedics started. This is my class. You can see that was 39 years ago, which is kind of scary. And I had the honor of giving the talk to our 40th year anniversary alumni meeting, which was very nice. And these are the guys that I trained with. And it's interesting because 2 years before this, we had the first two women in the class. We had Francesca Thompson and Laura Flawn. And HSS was very proud of that, but they were probably a little late to the game to get women in the group. And even this is a very homogeneous group. We got mixed up. Look at this guy here. That's John Healy, and that's me. That's Norm Johansson. So the chief, Phil Wilson, called me Norman. He called him Norman Nordstrom for about the first 3 years of our residency. We had one guy, Jerry Jones, was from Barbados. And Jerry is just the coolest guy. He's actually a jazz guitarist, and he's playing jazz guitar in Barbados now. And Jerry, on the far left, looking at the screen, had a beautiful lilting British accent from Barbados, and was really, he was the most eligible bachelor because the rest of us were all married. And he practiced in Jacksonville, Florida for about 20 years, and then went back to Barbados and worked at the medical school in Barbados, ended up assistant dean there, and has done a lot of great work back there. So that just gives you a little idea of the class. And what you guys, and ladies, pardon me, I use the term guys generically. You students, I call you students. You're not residents yet, you're students, that's right. It's orthopedics, I think, is one of the best specialties because of the variety you can do within it. That you can choose in orthopedics to really subspecialize. I mean, you could be a hand surgeon and just work from here down. You could be a trauma surgeon and cover everything. You can be a pediatrics if you want. You can do total joints and have the senior citizens. So that's what attracts a lot of people, in my opinion, and makes it a great profession because of the flexibility within it. And obviously you can go academic, or you can go private practice, you can go big group, small group, all kinds of things like that. Like, I think I know a guy who is a pediatric cardiologist. He's not going to open up his own practice in Somerville, New Jersey. He's got to be in an academic center. He's doing in utero interventions on people. Okay, so I'm just going to tell you what all these guys ended up doing. So John Healy, he did a tumor fellowship, and then he ended up chief of Memorial Sloan Kettering for the past 30 years. Okay, he just stepped down as chief, but he's still working full time. And the joke with Healy is his block OR time was Friday afternoon. And I don't know if any of you rotated at Memorial Sloan Kettering, but he sometimes will keep the residents there till 10 o'clock at night, just working and doing stuff with him and seeing clinic patients with him. Bright guy, probably wrote about 40 books and edited about 400 articles. Really smart, John Healy. And he just turned over the chiefship to a lady that he trained who had gone down to Johns Hopkins and was chief at Hopkins for a few years, and she's come back to Memorial. Very smart, great surgeon, and I got a mental block on her name right now. But you guys should look her up. Gary Savatsky did a fellowship in back then with a guy named McGinty in arthroscopy, because arthroscopy was new. Okay, the arthroscopy was, when I started, we didn't even do scopes, and we looked through the scope like this. We didn't have cameras for years. And Gary went into private practice in Central Jersey, so that's a private practice guy, sports medicine, general practice. Ivan Gallen did the fellowship at what was then called Job Curlin Institute in Los Angeles. It's now has Elastraci, who's a big guy. Elastraci just did Aaron Rodgers' Achilles tendon rupture. And so he did that fellowship when it was, one of the best sports medicine fellowships around. And he went back to Colgate, where he had gone to college and had a practice in Colgate for 40 years and built it up to a 10-man practice. He went back there solo. I'm just giving you this background so you can see all the options that you have. You want academics, you want, work for a university, but as a private practice. He didn't work for. And then here's a guy, Pat McMahon. Pat was in the Navy, so he owed the Navy some service. He had done his medical school and then an internship, and then the Navy took him for a year. So he came back to HSS and finished his residency, and then had to go back in the Navy and give them, I guess, 4 more years. He was all over the world. And then he came back and practiced in Bronxville, New York, which is the Bronx, and became chief of the VA in New York under HSS auspices. Jerry, I told you about, he's now playing jazz guitar in Barbados. Norm Johansson, this is another genius. He and Healy were the smartest guys. Norm stayed at special surgery. He did a pathology fellowship and really studied bone and stuff like that. And he ended up being chief at Drexel in Pennsylvania and Hahnemann in Pennsylvania. And then they had trouble. Somebody bought them, and the hospital went bankrupt. And I don't remember the exact circumstances. That was about that's probably 5 years ago. And he was still practicing, and he was running the residency program, and his 3 residents had no place to go. He had 9 residents, 12 residents he had to place. So he had to pull in a lot of chits to get his residents placed around the country, because this entity that bought the hospital basically went bankrupt. This is Dan Detmers, and he's been our only ghost. He left special surgery and then never heard from him. Never came to an alumni meeting. Never heard from him. The funny thing is, I gave my talk at 9:10 when Andrew was there at HSS. 2:00 in the afternoon, I get an email from him with the 40-year history of what he's been doing after the talk. So don't be late to the game. He's just never, but he's in the Midwest, he never came back. Phil Wilson was our chief, and he was a big guy in orthopedics. He was president of the Academy of Orthopedics. His father, Phil Wilson Sr., was president of the AAOS. Tons of stuff. He was one of the 2 guys Wilson and a guy named Stinchfield from Columbia went to England and studied under John Charnley when they were just starting total hips. So they learned how to do a total hip with John Charnley in England, and then came back and basically laid the groundwork for that in the United States. So that's a summary of what you can do, the variety of options, okay, which hopefully most of you know. Why don't you go to the next slide, and we may pull the slides off. Let's see what yeah, that's just special surgery stuff. Let's put that aside, and we'll open up for a few questions right now, okay? I would unmute them and see, or raise your hand if you have a question, or do it on the chat, or if you just want me to keep going about life. All right, there's a thing that I like to talk about. I talked about orthopedics being a good specialty to practice, to work in. It's also very good. I'm sort of jumping ahead to, how many of you have heard the term ikigai? Anybody know ikigai? Andrew should, because I mentioned it at the thing. No? Okay. How many people are on? We got you said 7 or
right now 19.
19. All right, well, that's cool. That's cool. I was going to set up a different screenway here. So this is ikigai. All right. And that's an interesting book. It's a short book. It's probably 120 pages. And it it's a Japanese theory. And basically it says this. All right. So that Venn diagram is the whole key. And what that has on it is, on the outside, it's what you love. What's your passion, or what's your mission? Okay. If you're, and it depends, you know, some people you may want to go to work in Ukraine, you know, when the country comes back, and oh, she's put it up. Lovely. Or you may want to work with children, you know, be a pediatric orthopedist. Whatever your love to do, your passion, your mission, you can do that. Then if you can do something, if we go to the pink on the right there, what the world needs, okay, that is, and believe me, the world needs orthopedists. We're going to be understaffed. The world needs doctors. You've all heard the statistics. As the baby boomers grow and everybody, we're getting, you know, we're going to consume a lot of medical care, and there's just not enough doctors. The medical schools need to open up their doors. I think there's a couple of new medical schools open, including one in North Jersey. So this is a mission or your vocation, okay, what the world needs. Then what you're good at, okay? You know, some people are just not good surgeons, and some, we call them congenital surgeons. They just have great hands. They know anatomy. They can find their way around stuff. They're good with soft tissues, you know. So you can be trained. You know, they say they can train a monkey to operate. I don't believe that. I think you have to have innate skills and a good frontal brain to be able to make decisions. But are you good at it? And are you good with people? I encourage you all to listen to your patients. Remember, the history and the physical exam, the patient's going to tell you the diagnosis themselves if you listen enough. But does anybody know how many seconds it takes normally when they video doctors? I'll say I was an orthopedic study, I think, this one. How many seconds until the doctor interrupted the patient when you walked in the room and you said, like, what can I do for you? Anybody got a guess?
Wasn't it like 11 seconds?
Yeah, 11 seconds you were interrupting the people. We're letting them, that's not enough time to say, my hand hurts, and And you're going, well, does it numb at night? Does it hurt when you do this? You know, you're cutting in. Just let them talk for a little bit. They really appreciate it. And the family member, a lot of times the family members with them, you know, if you've got a pediatric, you got a mom, if you got kids or you got adults with adult children. So the family members will appreciate if you let people finish what they're saying, and they're going to help you. They're going to give you the answer. So try not to interrupt as quick as we normally interrupt. Let them finish. So be good with people. That's a key. And treat the staff nice, treat the nurses nice. The nurses are going to know more than you for the first 8 months of a residency every year. You know, you start on July 1st. You are as green as can be. You'll get it, right? I mean, what are any of you third year yet? Anybody third year? So mostly first years or seconds? Well, what it doesn't, you know, but once you get into clinical rotations, really defer to the nurses until you get it, until you understand what's going on. They've been around a lot. And if I don't know if you have a lot of PAs, you know, that might have 2 or 3 years experience or 10 years experience, they're very knowledgeable and worth listening to. So we're on this, what you're good at, and that can be your profession and your passion. So you're lucky if this happens. And then what the world needs equates to what you can get paid for. Okay, so you know, there's not a lot of stuff that fits this where these things overlap. That's the ikigai. That's why you get up in the morning, and that can also not just be great for work, but it's great for longevity. If you have an ikigai that keeps you going, they've done studies in Japan, especially Okinawa, where you live longer. You have a happier, healthier, longer life, and you have a long health span, not just lifespan, because they've stayed involved. Because when you do this, you don't want to retire. You know, people ask me if I'm retired, I say yes, but I do about 5 consults a day. Sometimes it's on the tennis court, sometimes it's for the VA, sometimes it's just I'm working on stuff. Some are phone calls from people around the country, their back hurts, usually friends or former neighbors or stuff like that. And I still am able to use my talents. And I'm trying to figure out if I want to do more, but I'm not bored with retirement yet. I'm still having too good a time. So think of this. There's not a lot of gigs where you can do all this. All right. I have one daughter who wants to be an actress, but she was in New York for 9 years, never got past a certain stage where we don't know if she, you know, you need that break. You need that lucky break. We all got lucky enough to get into medical school. You know, you worked your butts off and you studied and you had the grades, but it's still sometimes a crapshoot to get in. So we can take that slide down, but that's a really good book and worth understanding. Any questions on that?
Hi, Dr. Nordstrom. Question: what was your ikigai?
Oh, hi there. Say that again, sir.
I said, what was your ikigai? Can you describe something? What got you going initially?
Okay, I didn't know it was an ikigai until, you know, that book came out probably only 10 years ago. But my intro to orthopedics was I like sports. My brother was a good athlete. My brother hurt his knee when he was probably 18 and I was 12. He was a high school senior, twisted his knee, he was a second baseman doing a double play, got hit and basically came home. Knee was big and swollen. We had no idea what it was. We took him to an orthopedist, and my dad was a gym teacher, so he knew something was not normal. And the guy was very good, did a physical examination, and then he was going to drain. He says, I'm going to drain your knee. And I was in the room, my dad was in the room, and the guy asked me, he says, do you want to help? You're the little brother, you want to help? I said, what do you mean? He says, here, hold this. He gives me a needle. And he preps up the leg and everything, and he sticks the needle in, and he has me draw back, and we take out this blood. He has a hemarthrosis. We drain the blood from my brother's knee, give him a cortisone shot, and I don't know if any of you have done that yet, but it's instantaneous relief when you decompress the knee. It just feels better, and then you give the cortisone shot, and that takes some time to work, but taking the pressure off. Or if any of you have put a Foley catheter in somebody who's obstructed and has a big bladder and can't pee, and they're in the ER and they just tore I got to put a catheter in. Oh, please no. But after you do it, they go, thank you. I feel so much better. So I was able to see in my brother immediate feedback. Okay. It wasn't like, okay, you got diabetes here, take this pill and maybe your blood sugar is going to get better. The immediate feedback was amazing. And then I think he was able to play some games, and the season was over. And then he ended up having a open meniscectomy back in those days, and he's done well. He played soccer, and he played college soccer, and he was in the Navy. So I saw a good result from one of my first exposures. So that was it. So I was 12 years old. So that had I think a pretty good impact. Is that what you were driving at, Dr. Kulkarni?
Yep, that's exactly it. Thank you.
Okay, so that was mine. Then I would also tell you guys that the path to orthopedics and the path to private practice or practice success is not a straight line. You're going to go boom, it goes like that. Okay, it's very, very zigzaggy and like steps in a ladder. And sometimes you go down. So just to tell you, if I can say this quickly, I was at Bloomfield High School, which is a run-of-the-mill public high school. I was going to apply to, what do you call it? Not Dean's List in college, but in high school. But I did good in school. I was going to apply to Princeton, Rutgers, and then I heard about a school called Hobart College in upstate New York. And I had trouble with my eyes, and my eye doctor was very influential with me. And I had to do stuff for actual depth perception practice as a teenager. And he convinced me to check out this school, Hobart College. I went up there, bumped into a chemistry professor on the college tour in the summer between junior and senior year. And we just hit it off. And my dad was with me, and my dad was a gym teacher for a while and then switched over to a chemistry teacher. So this guy walks me to the admissions office. I meet an admissions director named Weasel. And he says, this is a guy Nordstrom, he wants to come to Hobart, blah, blah, blah. We do all this stuff. So I get into Hobart early admission. So, okay, I'll take it. The odds of me getting into Princeton were probably 10%. Quote, Rutgers was the fallback school. So I went to Hobart. I did well, but I did not get into medical school. This is 1978. So I think I had one C on my report card. I had like a 3.8 average, a C in Western civilization. And I didn't get into medical school. Probably out of the 30 kids in the medical school pre-med class, probably 10 got in right out of college. And then another 10 went, back then they went to Guadalajara, Mexico, or to there was another one back then too. I want to say M something in Mexico. And I almost went with those guys, and I decided not to go. I was going to study more, work on my grades, work on my MCATs, blah, blah, blah. Plus I had my wife who was here at the beginning, she went to Keuka College, which is about half an hour from Hobart College. So I had a girlfriend who was 1 year behind me at this Keuka College. I didn't want to go to Mexico. So I reapply, I take more courses. I don't know if any of you, had a direct line right in the med school, but once I got into Rutgers. I got into Rutgers this next year. The one school out of 40, applied to basically 40 of them or 20 of them at a time back then. I got into one school, a guy named Dick Mason. Richard Mason was the dean of admissions, and somehow he accepted me. But I had taken courses at Columbia School for General Studies, some more science, some more chemistry, and just talked to everybody I knew about, what do you know? Do you have any connections? And how do you get into medical school? What do you do? And they just said it was a numbers game. It was just numbers, and they had, 1,000 applicants for every 10 spots, and they might as well throw it up in the air and just guess. So you're going to run up against that if you haven't run up against it getting into medical school, when you apply for residencies, and then, orthopedics. I think the match is one thing, right? The match is you get your internship and your residency together now. Okay. So ours was separate, but that's probably good. But the match is very stressful. And one thing for your health, for your ikigai, is to avoid stress. Now, good luck. You've picked one of the most stressful professions there is, and most of us were type A personality to get this far, so that doesn't help on the stress level. But if there's anything you can do to not put more stress on yourself, please figure it out. Have I figured it out yet? No. But I got into meditation probably 10 years ago. Pretty substantially. I'm actually going to a retreat next Monday. I'm leaving on Monday to go to what's called the Wisdom Well Retreat with a thing called MEA, Modern Elder Academy. And I'm going to study the science of awe, AWE, with a guy named Dr. Keltner, who's written a book called Awe. And Docker, I really like. I've actually taken. Do you guys know what MOOCs are? MOOC. You better. You're kidding me, Ty. You're shaking your head. A MOOC is a massive online open course. Okay. So, for example, Berkeley, University of Berkeley, has a MOOC, MOOC, called Happiness. And he's got one, Happiness at the Workplace. But this is how to get happiness. What is happiness? And Dr. Keltner is one of the 3 people who run this course. And a MOOC stands for Massive Online Open, everybody can sign up course. And they're free unless you want a degree. If you want to get a certificate, that course might have been a $45 certificate. Another MOOC I took was through a thing called edX, EDX. So Google edX.com. I've taken probably 10 online courses, but one was CS50 from Harvard, and it's Computer Science 50. It's the Harvard Intro to Computer Programming and Computer Use for their freshmen. It's the #1 course at Harvard, and the teacher is great, and it blew my mind because I didn't know anything about coding, but I took that course to technically learn how to code, but I just couldn't. It was too advanced for me, even though it was a beginnings course, and I was still working, so I didn't have time. I might take the course again, but MOOCs are really cool and fun. So that's how I heard of Dr. Keltner, because I took his course on happiness. He wrote a book called Born to Be Good. It's his theory of going with Darwin and survival of the fittest. Is he thinks it's survival of almost like the nicest. The people who take care of their kids, the better the kids survive. And as opposed to just the fittest, the toughest person in the jungle. Maybe it's the mama bear that has taken best care of her kids and hadn't had to fight anybody, just growled and kept people away. So that book was very interesting. And then he wrote this one on awe, And I would recommend it. I've read the book. I did an Audible of it, and I just bought it. So I have a hard copy to take to me to the course, because obviously I'm going to have to sign it. But he says there's eight, he calls it human, what's the word? It's like the 8 wonders of the world and the 8 wonders of awe. And I'll just have, for example, I think of awe as a sunset, sunrise, thunderstorms. To me, it's nature. But one of them is just human beings and their moral capacity. When you see people doing something nice, even for the, whether it's in a hospital or whether it's a study group, the human capacity to do good things. That awesome is an overused term now, but that is one type of awe. Another type of awe is movement, whether it's dance. So I'm going to be immersed in this for a week. So that's what I do to try to not be stressed out too much. And you've got to find something so you're not always questioning yourself. Most of us, how many here are your own worst critics? Right? There you go. But that probably got you where you are now, but it's dangerous because you're overly critical of yourselves. You got to realize you're in the top either 10% or 5% or 1% right now in academics. And when it comes to income, when you get out there, you're going to be the same way. You're going to be in the top 1 percentile of everybody making money. So good for you all when the time comes. What else? Is there another question? That got a little long-winded.
I have a question if that's okay.
Sure.
So, looking you up, I saw for a period of time you were the chief of orthopedic surgery at Robert Wood Somerset.
Yeah.
And I noticed there was a lot of firsts there. The first uncemented hip, some minimally invasive total knees, total hips.
Yep.
So I guess my question is kind of what motivated you to continue to push the boundaries of orthopedic surgery, and did you face any pushback at the time?
Good question. And yeah, there's a little pushback. I had very good partners that were willing to try stuff. And for example, ACL reconstructions. They used to be open. I mean, it was an incision about the size of a total knee incision. Okay, and then we started making it smaller and smaller and smaller. And then for a couple of years, we did the ACL reconstruction through about a 3-inch incision through the patella tendon. It was still open. It wasn't arthroscopic. It was through the patella tendon, and you had to get rid of the fat pad and everything, and you worked through there, but you used the patella tendon graft and did it. And then I think I went out and worked with Freddie Fu, who was a guy who was doing them through the scope. And my partner, Jimmy Paroli, had trained at Cleveland Clinic, and he could do a lot through the scope. He was very good with meniscusectomies through the scope, but we still hadn't done ACLs through the scope 100% back then. So we worked together on it, and then said, all right, we're gonna try this. And we always have the bailout. We can open it up and do it. It's funny because so that was arthroscopy, for example. With cement, when total joints first came out, they were all cemented. The hips was the cup was cemented, the stem was cemented. It's the way it was. And then they found out that the cement was sort of the weak link. The cement bone interface was hard. We used to spend time, we dried it. We dried the bone. Dr. Ranawat used to put epinephrine in a sponge, and we dried it up so there was no blood. And then you put the cement in, and you got all the bubbles out, and then you hit in the prosthesis. And it was a cement technique was taught as a separate course at the academy, how to cement stuff in to get the bubbles out, how fast you stirred it and stuff like that. So you got to have a little guts to try the first uncemented one. But I had been back at special surgery, new guys were doing it there. Guys from the chief from special surgery was a guy came up from Johns Hopkins, Andy Weiland. And at Hopkins, they were doing uncemented hips and knees. A guy named Hungerford was doing them. And he was bringing it up. He says, I want you guys to do uncemented at HSS. And most of the guys said, no, we're not going to. Savati, Ranawat, no way. We're not doing it that way. And then it took years to transition. And first, it was the cups we put in it with screws, lots of screws. I don't know, you probably put a total hip in now with no screws at all, most of you. You just smack it in. I know Kairos doesn't use any screws. But the first time we did it without cement, we were putting screws in, and sometimes you put 3 or 4 screws in, long screws. And there was courses at the academy of, okay, now we got to know what's on the inside of the pelvis, because you're reaming the cup and you're going to put screws in the pelvis. Okay, how far is the bladder? Where's the femoral artery? Where's the femoral nerve in the back of the wall so you don't hit that? And that was scary. And then somebody, I guess Harris, somebody in Boston, I think, said, well, we don't think you need screws in the cup, so you can just smack it in if you get the right fit. But then the trouble is if you're reaming wrong and you hit it too hard, you can burst the whole pelvis. So that was the problem with uncemented hips, is you could fracture the femur or the pelvis. All right, so it does take pushing the envelope, a lot of study. You look at the reports, you study, you practice. Like I said, I went to Freddie Fu and I did some with him. I'd gone to Dana Mears in Pittsburgh. This is when I'm in practice. I had taken a pelvic fracture, put the guy on the plane with me, and went to Pittsburgh with my patient for Dana Mears to fix this guy's acetabular fracture. And that was a big exposure. He did a Y exposure. It was a part like posterior hip and then an anterior Y on it. That's what it was called. A big exposure. But somebody out of Boston read it up. And then I got interested in pelvic fractures, acetabular fractures. So my senior partner says, okay, you want to learn them? I'm going to send you to Paris, and you're going to work with a guy named Émilie Tournelle. So I went to Paris for a course on pelvic fractures with this guy, Émilie Tournelle, and his mentor was a guy named Judet. So when you get into pelvic x-rays, you're going to learn to do Judet view and all this kind of stuff. So that was just amazing because we had cadavers in Paris. I dissected in the Paris morgue. They didn't have a lot of rules like we have in the US here, but we didn't even wear masks back then and in working on the cadavers. So it was really wild, but I learned the pelvis inside and out. But you got to keep learning. Remember, this in medicine is a lifelong learning deal. Okay. Because when I started, Ancef didn't exist. Cephalosporins didn't exist. So you got to remember, I don't know the statistics, but it's something like 10% of what you learn every year is new, and 10% of what you learn every year turns out to be wrong. Okay? I lived through the opioid epidemic, where pain was the 5th vital sign. You guys, you've heard that story, but you didn't live, where pain was the 5th vital sign. So the patient was basically not allowed to have pain. And I gave people IV self-controlled patient-controlled analgesia, that they could just drip in morphine, and they were slogged. It was terrible. It was stupid. But that's what we did for a while. And it was really wrong. And I prescribed some OxyContin in my day. But I had a guy go into withdrawal in 3 days from OxyContin, and I never prescribed it again after about, 3 months using it. So you learn, and you got to realize you're going to learn. You gotta keep going to classes. I go to the academy meeting, and it's funny. My junior partners, they don't go to the academy meeting. They don't like it. I love the academy meeting. It moves around. every year it's either Los Angeles or San Diego or Chicago, Washington, Vegas, wherever there's a couple of big conventions. Those 5 cities they rotate through, and it's just phenomenal. And you can pick, what days you want to go and what lectures you want to go to. Any of you been to an academy meeting yet? So try to, in your 3rd or 4th year, if you can convince the medical school to send you. That's the AAOS. And it's big. It's 20,000 orthopedists from around the world. And if you are a spine surgeon, you go to the spine meetings. If you're a tumor surgeon, you go to the tumor meetings and you hear John Healy talk. If you want total joints, you go to the total joint meetings. And you can get you get 35 to 40 CME credits in one shot, 1 week. And it's cheap. It's very, very good. So keep going to meetings. That's why I'm fortunate that Hospital for Special Surgery has this alumni meeting. You all can go on the HSS website and they have, online courses they're given all the time. They have a December, it may be now, it's December total joint meeting that they always hold by the Roosevelt Hotel or the Hyatt by the, and it's just phenomenal. The best guys in the world come in and talk there. So you could virtually probably watch it now. Or what I do is I go, and I used to, if I liked what a guy said in a lecture, I would, buttonhole him afterwards or meet him at a cocktail party or get more info out of him. So always ask questions, keep studying, read the journals, because it's very hard to keep up. That's why you're going to end up, most of you, probably 90% of you will do fellowships and narrow your field so that you really get good at that field. There are a lot of people now who are doing 2 fellowships. I don't know if that's necessary. And that's 7 years out for you to make that decision, or 9 years out. I hate to admit that. If you're a first-year student now, you got 3 more years, 4, residency, internship, residency, there's 9 years right there. So you're gonna, add another year on for a fellowship. I'm afraid most of you will need fellowships now, because I know when we were hiring, we were not looking at any general orthopedists. We wanted somebody fellowship trained. And I hired a fellowship trained shoulder guy. I hired a fellowship trained hand guy. And then at the end, my practice sold to a big group called the Summit Medical Group. And so I went from a 3-man practice to a 30-man. I went 3-man to 12-man and women to a 30-person practice, over the course of 5 years at the end of my career. So there's another book that I really like, is called Life is in the Transitions. And I actually wrote out, I think I had 14 in my almost 40 years of practice. I had 14 different permutations of practice, partners, no partners, bigger practice, private group, joining a big group, stuff like that. So your careers are going to be varied, especially if you go into academics. You'll go to academics and you'll work someplace for a couple of years, and then you'll move, you'll jump, you'll move around the country. That reminds me of one thing. When you're looking for residencies, etc., location is very important. And a lot of it will depend on whether you have a spouse or significant other, to what they want to do. My wife was working in advertising, so Manhattan was a good place for her. She worked on Madison Avenue, so she loved being in New York, and it was perfect for her career. So when we looked at residencies, we looked in San Francisco, we looked at some other places like that, but I went from Rutgers right into Manhattan. I did my internship at Lenox Hill and my orthopedics at HSS, which are only 5 blocks away from each other in Manhattan, 77th versus 71st Street. And we had hospital housing, which was good. We even had a garage. We had a car, which is rare. You can't afford to even have a car in New York. You don't really need one, but I think that my garage space cost me $25 back then, which is kind of neat. So keep learning. Any other questions? Does this run for an hour usually, Cindy?
Yes, I was just about to say thank you, first of all.
Yeah.
And if anybody has any other questions, we like to open it up just about orthopedics, Dr. Nordstrom's life,
I
anything
love
else.
love to talk about life and how you can, you know, don't
Uh,
just do one thing. Be diverse.
yeah, thank you for the wonderful talk. So you mentioned that arthroscopies and uncemented, hip replacements were the new thing back in the day. So what today are you excited about, and where do you see the future technologies going in the field of
AI,
orthopedics?
AI. How many of you have Chat GPT on your phone? How many? Anybody else? Yep, I got it. Okay, so AI is gonna just blow our minds. And I really like the guy Sam Altman, who I've listened to him talk. He's also a meditator, Sam Altman, meditates with a guy named Jack Kronberg, who I know. And he's the guy that got fired 2 weeks ago and got his job back within a week. They fired the board, basically. So I think AI is going to be big. Computer generated, what's that called when you custom make a total hip? You know the term. I'm blocking. I got a mental block on it. But that's going to be big, and also biologics. All right. When I was at special surgery, we had a rheumatoid arthritis clinic. Half of our total joints were on people with rheumatoid arthritis. They were crippled. I mean, they could barely walk. And I tell you, in the last 5 years, I don't think I operated on one rheumatoid's total knee. It's all osteoarthritis or post-trauma. So the biologics have done great things at a great expense. They're crazy expensive, like $20,000 a month for some of the meds, but the biologics are good. We still haven't figured out PRP, platelet-rich plasma, that injection, right? Can I take your blood and give it to you and make you better? Is that better than a cortisone shot? They've done studies, and the answer is yes. They've actually proven for tennis elbow or for knee arthritis that PRP is better than cortisone or placebo, but it's still not covered by insurance. So I'm in Florida down here. This is, the Botox capital of the world, probably. Yet it's also the PRP, the shot, but it's a lot of it's bogus. These guys are charging $1,500 a shot, and you got to get 3. So what's that? That's $4,500 in your knee in 3 weeks. That's more than a total hip pays you. And this guy's just giving injections. So something's going to have to be done with the biologics. So AI, computer generated design, biologics. That's the next frontier, in my opinion, humble opinion. And you also put Chat GPT in your phone, and you can talk to him, and don't let him write your papers. And it's funny because I asked him, what do you want me to call you? And he said, Chat GPT is fine. I'm calling him a he. But my Siri is a female voice. My wife's Siri is a male, sounds like a butler. And also there's Callie. Do you know Callie? Callee. It's the same company, OpenAI. And Callie can take a picture and turn it into script, or it can take a script and turn it into a picture. So it's like unbelievable. And you put those two will get you started on AI and being up to date on that. Because if you know that much stuff about it, you're going to be ahead. You got to get ahead of the game with that now, because other people are going to do it, and you're too busy studying, but learn from it a little bit. But the funny thing with, as you know, with ChatGPT, they can't tell you, who the president of the United States is now, because their information stopped. Well, it's actually, they've moved it up. They now have information up until April of 2023. When it first came out, it had like January 2022. So they keep adding information, but they can't tell you specifics of what like the weather's going to be or stuff like that. So it's not search. I like the term augmented intelligence. It's a term that Deepak Chopra uses, augmented intelligence, as opposed to artificial intelligence, because it's not artificial. It's us, garbage in, garbage out, right? We put the information in there. So you know what they call when you talk to ChatGPT? What do they call it? It's a prompt, right? You have to prompt him or her or it the right way. If you don't give it the right prompts, you're going to not get good information. So you have to learn how to prompt. And that's actually courses. There are people now making a living teaching you or me how to prompt my AI so I get the right answer. Because it does a thing. Have you heard the term hallucination from AI? You can ask it a question, and you can ask it the same question tomorrow, and it might give you a different answer. And but it answers, ChatGPT answers like it's very accurate. It answers with confidence, and that's called when it's wrong, it's called hallucination. They say that my AI is hallucinating because it thinks it's giving me the right answer, but it's wrong. So that's a wild field. You need some time, baby.
Okay, thank you. I think we had one more question that was pre-asked by somebody. I don't know if Nicole, if you have it ready or.
No, I thought Jason might have taken himself off of mute to ask a question. I don't know if I was
Oh,
just.
I'm sorry.
But
I was actually going to ask about future innovations in ortho, so that worked out perfectly. Thank you, Dr. Nordstrom. And I was wondering also if you still keep a professional email that we can maybe reach out with questions following up or anything.
Sure. You can get it from Ty, but if you want it, I'll just say it now. It's just Dr. Nordstrom, no caps, no periods, at AOL.com.
Thank you.
So Dr. Nordstrom, Nordstrom at AOL.com. And Sydney, I had commented to you that if this was well received, we should do this again, but like 6 months from now, not next month, but let's push it off. If you can't get somebody, if you need me to fill in, but, to come back to talk to you folks again in July. Yeah, let's do it, July, after you've changed rotations or moved up a year.
Yeah, absolutely.
Because you'll have more questions, as you move on. I would highly recommend you do electives off the Rutgers campus too. Okay. In anything, not necessarily just orthopedics. I did my general surgery elective in Charlotte, North Carolina, UNC. I did an orthopedic elective at Columbia Presbyterian, and I did an orthopedic elective at HSS. And you're going to find there are very different programs. They called HSS a gentleman's program. Okay, we had a Christmas party at Rockefeller Center where we all went ice skating. Okay, at Columbia, it's basically back then. I don't know now. So I don't know. It was an abusive program. They beat the shit out of the residents, and they worked like dogs, and they slept in the hospital, and it was every other night call. We were that way too for my career. It was every other night until like 4th year, and then that changed with the Libby Zion disaster at New York Hospital when I was there at that time, because New York Hospital is right next to special surgery, so that's the general hospital we use. So do electives off campus, get ideas from professors or people where you would like to go, or say, for example, if you want to do your residency at Mayo Clinic, try to do an elective at Mayo Clinic. And it may not have to be ortho. You could do ER, you could do medicine, whatever. But get away from the Rutgers enclave. And again, I think you need exposure.
Thank you very much for those tips and for sharing with us.
Very good.
And thank you guys all for joining tonight. As Dr. Nordstrom said, we'll probably do this again, but it'll be with a new e-board since it's the next calendar year. We did have an attendance form. I think Nicole just sent it again. As always, reach out with any questions. And yeah, have a good night. Thank you again to Dr. Nordstrom.
Nice.
All of us may be in contact.
Take
Thank
care.
you.
Bye-bye.
Thank you.
Bye,
Thanks for
everyone.
setting it up.
Of course.